All right, welcome. I'd like to talk today to everybody about managing the CrossFit athlete. My name is Sean Rocket. I'm an orthopedic surgeon for the CrossFit Games, and I work with CrossFit Health. I have no disclosures. Starting off the topic of what is CrossFit. CrossFit really is a way to improve your fitness. People in CrossFit define it as constantly varied functional movements performed at high intensity. And if we're looking at fitness and the definition of fitness, really it's increased work capacity across broad time and modal domains. So what does that mean? That means being able to move your body, being able to move weights across your lifetime using a variety of different methods, whether it's running, lifting weights, biking, anything where you're moving body, moving weights, getting fit, improving your fitness over that time period. For people not familiar with CrossFit, some vocabulary, looking at WODs. What is a WOD? WOD is the workout of the day, which is typically measured and recorded. And that's where the fun comes in, where people can sort of see how they improve when they just start CrossFit, and even over your whole journey of CrossFit, you can see how well you do. The box is the gym and the community around it, and that's a real important part of CrossFit is the community around CrossFit. The CrossFit Games are where the Games athletes, or are the highest level elite athletes, are performing some pretty amazing events. And for somebody who's not familiar with CrossFit, seeing the Games can be quite intimidating. And so we don't want people to think that the Games athletes are what people out in the regular CrossFit world are doing. They're doing the same types of movements and maybe at less weight or with a little less intensity. So if you're a physician or a healthcare worker and you see the Games athletes, again, those are the NBA, NFL type players. There are other people who are playing pickup football, pickup basketball, and that's the typical CrossFit is when you're in the gym doing workouts. I'm going to talk today about how to modify and scale. So especially when there's somebody new to CrossFit or somebody hasn't heard of CrossFit, it's really important to be sure to stay safe when you're starting. And if you're a physician or a healthcare worker, being able to advise your patients about how to get into it and how to be safe doing it. And that's a lot of what we're going to cover today. The nutrition that is recommended is typically, and in this sort of summary statement, eating meats and vegetables, nuts and seeds, some fruit, little starch, no sugar, keeping intake to levels that will support exercise but not body fat. The trainers who coach people and train people at CrossFit are certified at analyzing movement patterns for proper form. They're certified at scaling, dealing with people who are older, the masters athletes. Certainly if you're going into CrossFit or you have a patient going into CrossFit, knowing prior issues and discussing them with your physician ahead of time is important, and even discussing them with the coach, having the patient reach out to the coach. Maybe the coach can talk to the doctor to talk about prior issues that the patient has in their medical history. What are the benefits? Really, if you look at every organ system, there are benefits almost in every organ system, starting from the top with neurologic issues. There are many of my friends who have neurologic conditions, even Parkinson's, who say that their symptoms are better when they exercise. And even mental health conditions, anxiety, depression. This is a way that people are managing their mental health issues and thriving really with them without medication. So it's a really important part for somebody with that condition. Looking at cardiovascular and blood pressure, there's definitely studies showing high blood pressure, hypertension improving with exercise. Pulmonary endurance, your respiratory endurance improving with exercise. Blood sugar, people with type 2 diabetes, plenty of cases of people who have come off their diabetic medications from exercise. Osteoporosis, people with osteoporosis improving their bone density with weight-bearing activities, really the first line of treatment for the treatment of osteoporosis. So if you, again, any organ system, there typically is a benefit with diet and exercise. It was Hippocrates too, who that was one of his first treatments, was diet and exercise. So this is not a new recommendation or prescription. This has been around since, you know, the many early hundreds of years BC. This picture is a picture of a sunset, and it reminds me of my level 1 taught by Austin Malleolo, where he said fitness should be achieved with a low trajectory to a distant point on the horizon. So what does that mean? That means not coming to CrossFit with the plans of just working out for 2 or 3 months, getting ready for the summer, and then moving on. It really should be a long-term plan, a very long plan for fitness over many, many months and even years. I've chosen it as sort of my primary form of exercise just because I feel like I'm in control. I'm not playing in a pickup game where someone else can come and tackle me or you know, elbow or push or shove, and I'm not going to get injured because I'm controlling myself. So that was really one of the appeals for me. People can have issues if they come into CrossFit doing too much, too soon, too fast. Recovery is very important with CrossFit. Most people will recommend at least 2 days a week of resting or mobility and stretching and not CrossFitting. The reason that's important is that your muscles can experience some pretty significant stress, and they need to heal and recover. So it is important as a part of CrossFit. Recovery and resting from CrossFit is really an important part. If we look at strength training and age, typically the 20-year-olds will really get away with a lot more than the 40 and 50-year-olds. When I give a lecture on injury prevention, it's really kind of filled with the 40 and the 50-year-olds. The 20-year-olds sort of come and they listen, but a lot of what I'm going to say is really directed more towards the 40, 50, 60, 70-year-olds. 20-year-olds have capabilities of getting away with a lot more. Masters athletes, we have good news and bad news. The bad news is that we are getting older every day. We are dehydrating every day, and that is part of aging. Dehydration of what I'm talking about are the tendons, the ligaments, the discs, and the cartilage. There's a change in composition. There's a change in protein manufacturing, which just occurs throughout an aging process. I do have good news. The good news is that strength training can lead to muscle hypertrophy and a reversal of the alterations in your muscle architecture associated with aging. So what does that mean? If we look at an anatomy picture of a muscle tendon unit, you see the muscle up on the top is attached to the tendon, which is then attached to the bone. So if we look at that tendon attaching to the bone in the lower right, you'll see on a cellular level, the tendon attaching into the bone. If you exceed the strength of those cells, and if you pull too hard, or you have a weight that is beyond your capabilities, that can lead to a tear of your tendons. So you have to be very careful. The other part is that when you are building your strength, you can change that cellularity of those tendons. You can change the process of aging through weightlifting. What I see a lot of is that somebody will actually do too much lifting, and they love CrossFit, and they come into CrossFit, and they'll start doing it more and more and more, and they might start not listening to their body. And a really important part of what I'm saying today is really you need to listen to your body. You don't want to push through pain, and this is a very important part because it can really start as a very mild what we say here, tendonitis. And when you talk about a tendonitis, people say, what's a tendonitis? It's actually a tear of your tendon, but they're microscopic. If you look on the right, you'll see the tendons, a nice, beautiful structure of a tendon on the right, and on the left, you'll see little microscopic tendon tears. Those blue cells are your body coming in trying to repair that micro tear. That condition is a tendonitis, and your body will send pain signals and pain fibers to your tendons, and those will be very mild to start, but if you keep not listening and you keep pushing through that, then that sometimes can worsen. So how do you get a tendonitis? Again, it's a change in activity, typically at the start of weightlifting, say in CrossFit, where people haven't been used to weightlifting, and all of a sudden they start weightlifting. You have an increased frequency if they come several times a week, a little increased intensity, which is part of the prescription of CrossFit. But again, being reasonable to start when you're scaling in the beginning of your program. Increase weights. Some people haven't weightlifted at all. Some people haven't put weights over their head. Increase repetitions. A lot of people aren't used to the numbers, and so that what can happen is that can lead to a tendonitis, which will be pain. Typically, if you catch this pain early, the good news is it'll get better on its own. If you keep pushing through it, it'll snowball and it'll get worse and worse, to the point where sometimes in a shoulder you can't sleep. If it's a knee, sometimes you have trouble climbing a stair. So something that could have gotten better within 2 weeks of rest or modifying is now 4 months later to the point where you can't function. So really important to listen to your body with this. The beauty of CrossFit is that you do have a shoulder issue. You can certainly come to the gym and show up at classes and do other things. You can do lower body stuff. You can always scale. There's always another exercise you can do if you have an issue. We see some of these adaptive athletes that have come in recently to the fold, seeing what they're doing and how they're adapting and how they're exercising is really a great lesson. If somebody has an issue with one body part, there's always something else that can be done. If I ever had somebody come in and I say, okay, well, you have a tendonitis, guess what? You have to stop running, or you have to stop lifting, you have to stop doing such and such. If I ever tell them stop, completely stop, as opposed to modify, you have to modify. If I ever tell somebody to stop, especially like a marathon or long distance runner, if I ever tell them they have to stop. So I always say modify. This is sort of what happens in the office visit. There's tears, there's crying, it's terrible, but we have to sort of, the important part is keeping somebody involved, keeping somebody at the gym and modifying what they're doing, keeping them healthy, getting them to improve, but not having them completely stop exercising. Because again, exercise is a really important thing to do for a lot of people. I look at somebody in CrossFit as just like an elite athlete, or just like somebody who's a basketball player, soccer player, baseball or softball. If you've ever heard somebody say, oh, why are you CrossFitting? You should stop CrossFitting. And if somebody loves it and somebody enjoys it, then the issue is you really sort of want to meet that person where they are. So you want to say you got to be safe, you keep things moderate, keep things, watch out for your intensity. As you get more adept at it, you certainly can improve things, and you can improve your weights and improve your intensity. But to start, it's always important to be to modify and to scale as you move up. People often will ask, when do I refer to a doctor? When do you refer to somebody? If something rips, tears, or pops, that's usually a condition that needs to be sent to an orthopedic surgeon. But a tendonitis, typically, again, is give it a couple of weeks at least. If you don't have an injury and there was just sort of mild pain that started, give it a few weeks, modify, see if it gets better on its own, do some mobility and stretching. My website's called 321GoMD. It's a internet site that anybody can go to. It started with people asking me when I was at my gym working out at CrossFit New England, I have this shoulder thing, I have this knee thing, what do you think it is? And I would say, okay, go to that site, read about it, and then, if it continues, then come see me in the office. So anybody's welcome to go see it. I like it because it's got great pictures on it, so I use it as in my patient visits. This lecture I'm going to start or get into with different body parts and what I see, especially with something like the different movements that we see. So front squat, back squat, overhead squat, and pistols. Typically, I see a lot of knee issues with that. And if you look on the bottom right, you see a pistol. You'll see back squats, front squats, overhead squats. What can happen is people can develop pain in the front of their knee, called the patella, and against the femur. When the patella rubs up against the femur, they can get a tendonitis, or they might have a meniscal issue. If you look at the anatomy here, we'll see the patella rubbing up against the femur in flexion. That's the quadriceps tendon and the patella tendon below it. If you look at this sort of force diagram for any engineers out there, you'll see that as you bend, as you flex your knee, the force of the kneecap going up against the femur increases in flexion. So if you look at a normal healthy knee on the bottom left, you'll see a nice, beautiful, smooth, articular cartilage. That's your joint surface. If you look in the lower right, you'll see an arthritic area where there's sort of sandpaper roughness, loss of that cushion. So you can imagine if someone's doing a lot of squats, say, front squats, and they're flexing and bending, and they have some arthritis to begin with, they might get some soreness, they might get some swelling. And so it's important as a coach or as a physician or healthcare worker to hear this, their complaints and say, okay, what have you been doing? You've been doing a lot of squats, maybe hold off on the squats, do some upper body stuff, and then even if it hurts, even after resting and they have known arthritis, then maybe limiting the depth of their squats. It's still important to work on range of motion, but if you wanted to add some weight and you're having pain going full all the way, down below 90 degrees, then maybe limiting the range of motion is important initially until somebody can build up enough quadriceps strength to do that. If somebody just has arthritis and they have pain, then there's certainly other things that we can do for them if they have arthritis and pain, even despite modifying. The meniscus is the cushion or the shock absorber, and you see it here on the left. It's the structure between the femur and the tibia. And sometimes when you get into a squat, if it's a heavy weight and if you torque or twist, that can lead to pain. And typically it's on pain in the back of the knee. People will feel like it's in their hamstring area or on the sides of their knee. So an important part of that is if you're doing the squat, keeping the weight manageable, making sure it's not too heavy and that you're not rotating or twisting in the squat, which can lead to a shear stress in your knee and sometimes can lead to a meniscal tear. Moving on to pull-ups and muscle-ups, you see the pull-up on the left and a muscle-up on the right, or ring muscle-up. This can lead to issues with the biceps, and I've seen issues with biceps in this position, in these positions. You see on the anatomy structure, you have the long head of the biceps in the front of the shoulder. People will typically outline if they have a biceps tendonitis, they'll point right to the front of their shoulder. And then you see as it enters into the shoulder, it attaches to the top of the labrum. So here's a picture of the biceps coming into the shoulder joint with the humeral head removed. And you have the superior labrum, which is where the biceps attaches to it on the top. On the left, you see the rotator cuff, and the biceps is absent from that structure, but it's typically right in the front of the humerus. So when you are into a lot of pull-ups, typically ring dips, or having issues with overhead activity, it can lead to sometimes a biceps tendonitis, which we see here on the right. You see on the left a nice, beautiful structure of a nice biceps tendon attaching to the top of the glenoid, which is the socket, and it is attached through the superior labrum. So that's the labrum, which is the cartilage structure on top. You can see a partial tear of the biceps on the lower picture, and that can be from an injury, arm pulling, and I'll go on to a traction injury, and I'll talk about that with the next slide here. So what can happen with pull-ups or muscle-ups is if you, we call the peel back mechanism, where your arm is overhead and you abduct and externally rotate, the biceps at the top of this can pull over time, and it can pull to the point where it pulls off the socket. And so you get what's called a slap tear or superior labral tear. The other thing that I hypothesize that when people are up overhead and say a muscle up and they come down and they're coming down from the muscle ups and their body weight is being held by typically the biceps up above, that there can be a traction injury where there's a pulling on the biceps. So if you're fatigued and you're trying to hang on to that pull-up, recommendation typically is just let go. Don't let your whole body weight come down and your whole body weight being held up by a fatigued arm and shoulder, which can lead to traction injury on the biceps. So typically what we'd see would be anterior pain, pain in the front of their shoulder, biceps pain. And the question is, if somebody comes in and they've been doing a lot of pull-ups and they've been doing a lot of muscle ups, do they have a tendonitis, which is just not an injury, but a micro tears or micro injury, or do they actually have a tear of the labrum or of the biceps? Most common thing would be just see if that heals. Let that rest and modify, see if it goes away. If it goes away and you feel great after 2 or 3 weeks, then that's typically a tendonitis. That's the simplest. If it gets to the point where there's mechanical symptoms, clicking, cracking, crunching, therapy doesn't help or injections don't help, then we would investigate that further with possible MRI. There always is a surgery for a tear of the biceps called a biceps tenodesis, but again, we try to certainly avoid that. Moving on to snatches, presses, and jerks, and you see up overhead we have that can be a push press or the end of a jerk, and we have below we have a jerk below where Julie is pushing that weight up overhead. Snatches is typically from the ground pulled up overhead. So that is talking about snatch, that's a forceful high velocity maneuver where your weight is going up, the weight is going up over your head, and sometimes can go even behind your head, and if you're not careful. And so number one is anybody starting snatches should really be very careful with this, especially if you have a history of a subluxation or a dislocation of your shoulder. People who dislocate, typically the most common is dislocating in an overhead position. So if you have a history of this, really have to be careful and modify, being careful not to get that weight back behind you over your head. You see here the picture of the shoulder, and at the bottom picture on the left, you see that wall, that ligament acts as a nice wall, the ligament in the front of the shoulder when your arm is up overhead. And if there is a tear or a labral tear that you've maybe had before, you can see if there's a detachment in that lower right corner called a Bankart lesion. That's an inferior labral tear where that ligament, instead of being a nice solid ligament, is loose, and that allows your shoulder to ride forward. If it rides forward, that's a subluxation. If it rides out, that's a dislocation. Moving on to impingement. So when we go up overhead, people can get a bursitis. Sometimes if they have a different shape of this bone called the acromion bone, the bone up above here. And if there is a hook to that bone, when your arm is brought up, you can lead to rotator cuff issues or bursitis, or just pain where you develop pain in your bursa. Important for that to, when you are overhead, keeping your shoulder blades pulled back, being careful not to have too much overhead activities, keeping them moderate, especially if you have pain when you go overhead. If you have pain when you go overhead, certainly need to modify, shouldn't be pushing through pain, because you could have a bursitis that's not getting better, or even a rotator cuff issue. For impingement, typically it's pain down the lateral side of the shoulder, the lateral side. People will say it even refers down their arm. And sometimes there'll be clicking. Typically it's physical therapy, sometimes a cortisone injection, PRP injection, and again, can investigate further if needed. Looking at somebody who is very mobile, they don't have issues with laxity they don't have issues with mobility, they have issues with stability. So someone who has loose ligaments, someone who can touch their thumb down to their forearm or push their finger all the way up and bend it back, or hyperextend at the elbow, they have more stability issues. And if somebody has a loose ligaments in their elbows, or say in their shoulders, and their shoulders are moving around, they really need to work on rotator cuff strengthening exercises, stabilizing exercises. And that's part of CrossFit, really, is building up your upper body, building up your back muscles. Rowing is a great way to work on the scapular stabilizers of the muscles around the shoulder. Moving on to deadlifts and kettlebells. Really important to avoid pressing the back of the ligaments in your back. And when you're doing a deadlift, avoiding that deadlift position where you're flexing your spine. Even with kettlebells, keeping your chest upright, vertical, where you're not leaning forward, you're not pulling too much pressure on the back of the spine. And when I say the back of the spine, the posterior ligament is where the discs can herniate. So keeping your lumbar spine, as you see the picture on the right, keeping your lumbar spine vertical, if you flex at the lumbar spine, that can lead to sometimes disc herniations. That's the most common mechanism for them. And that can be pain radiating down your leg with sciatica, typically with numbness and weakness down the leg. So really important to avoid stressing the back, too much weight, careful on the deadlifts, maintaining your form. Intensity will come, but again, starting reasonably and moving up as you feel comfortable. Double unders and box jumps. This is a body part typically that I see with double unders and box jumps is the Achilles tendon or calf tears. And what is that? And you can see a box jump is where you jump from the ground onto the top, as you see here on the right. Double unders where you do a jump rope and there's 2 revolutions of the rope under your feet as you jump. So the gastroc, the calf muscle, and the soleus muscle, those are the muscles, and then they blend into the Achilles tendon. What can happen is somebody's doing a lot of these double unders and box jumps where they're jumping up and down. You can get what's called a tendonitis of your Achilles. And if you look at the middle picture, you see this swollen Achilles tendon as compared to a normal tendon on the left. You see the normal tendon on the left over there. If you look on the right, that's what can happen if you do a rebound box jump. So if you land and jump up quickly as opposed to land completely, then jump, then you can lead to a stress on your Achilles tendon. So we recommend that people who are everyday CrossFitters, when they jump off the box, they land, and then you jump back up, as opposed to hit your toes and jump back quickly. That's called a rebound. Be very careful with the rebound because we've seen this, and this can happen. For Achilles tendonitis, typically it's eccentric strengthening. The way, as we said, the way you tear is with an eccentric stretch when you're rebounding. So tendonitis, any tendonitis can be treated with eccentric strengthening, which is lengthening the muscles and strengthening them at the same time. Be careful with overuse when you're doing double unders and box jumps for the first time to avoid a tendonitis as well. So again, feel free to check out 321 GoMD. It's a website for CrossFitters with medical diagnoses written for anybody to pull up and see, to look at any body part, knees, shoulders, hips, ankles, elbows, etc. So in summary, CrossFit should be safe. It should be fun. It should be long-term fitness. This is a marathon of fitness, not a sprint. Feel free to check out 321 GoMD. My name is Sean Rocket. This is my group, Orthopedics New England, out of Natick, Massachusetts, with offices and outside of Boston.